We'll start us right. All right, thanks, Sam. October is Domestic Violence Awareness Month, and unfortunately, we've been addressing this topic a lot through the pandemic. Dr. Tracy Brennan is an obstetrician gynecologist with Hartford Healthcare's Hartford Hospital, and she joins us live right now. Doctor, welcome.
Thank you, Lisa. Thank you for having me.
Absolutely. So how has COVID-19 impacted intimate partner violence statistics?
Well, unfortunately, historically, during any natural disaster, there's an uptick in intimate partner violence, usually an expected 20% increase in incidents. In Connecticut, our shelters have been operating at 145% capacity during the pandemic, and this includes our stationary shelters and the hotel rooms that we've had to access for victims to observe appropriate social distancing. There's a number of factors that have led to the increase in intimate partner violence. The social isolation, for sure, financial stress and joblessness, children being home doing distance learning can add to stress in the home, and an increased intake of alcohol during the pandemic have all led to the increase in incidents, unfortunately.
So sad. All right, you're an OBGYN, so what protocols are in place to help identify and help victims of domestic abuse? Many
of the healthcare providers in the state of Connecticut have been trained by the Connecticut Coalition Against Domestic Violence, their health professional outreach program, to do universal screening, a battery of questions that are asked when patients arrive in the office. This same universal screening is being done on all hospital admissions and in the emergency rooms also. And providers have been trained on how to respond if there is a positive response from the patient and how to help that patient access resources.
Okay. Do victims of intimate partner violence suffer more physically or emotionally?
You know, Lisa, intimate partner violence really is a public health issue on so many fronts. It's associated with many of the diseases that we deal with on a global issue, asthma, diabetes, hypertension, cancer, chronic pelvic pain, chronic depression, and an issue that's particularly near and dear to me as an OBGYN, maternal mortality. The single most important cause of maternal mortality in this nation is homicide. And 50% of the time that homicide occurs at the hand of an intimate partner. And that's something that we must change in this country if we're ever going to impact maternal mortality.
And not only that, but the stigma that we have to erase. Or what advice can you give to someone who may be a victim and is feeling isolated right now?
You know, the most important thing I can say to people is please reach out. Help is available. I think all of us, health providers for sure, but all of us have a responsibility to open this conversation, even in our personal social spheres, to make it known to women that they can talk to us about this. I always say to people, 1 in 8 women in this country are diagnosed with breast cancer. 1 in 4 women are victims of intimate partner violence, either currently or in a past relationship. So when people say, oh, I don't know anybody in my life, or there's no one in my life who's suffering with this, there actually is. We just may not know it. So we've got to open the conversation. The phone number for CT Safe Connect, this is a number that we can text, email, or call. You can call anonymously. There is no obligation to share details of your life. And this is a number that I think all of us should have at our fingertips to help friends and family who may be suffering.
All right, Dr. Tracy Brennan, great information. We'll have more on WTNH.com. Thanks for being with us. And
thank you so much.
News 8 at noon will be right.